Hi, I'm Dr. TANVEER JANJUA. I'm a board-certified facial plastic surgeon, and today I want to present a facial consultation. When I meet a patient for the first time to discuss their face, I really want to diagnose what is going on with their face and what are all the options available to my patient, and this way they can make good decisions and we can together work towards maintaining the face for a very long time. And I'm very fortunate today to have Corinne here, who very kindly agreed to be photographed and videotaped for this consultation, and hopefully it will help a lot of other people. So welcome, Corinne, and thank you.
Thank you. Very nice meeting you also, and I'm excited.
Good. So and when I start a consultation with a new patient, I always give them two options.
Okay.
One option is to just answer their questions about things they came for. For example, if they came for Botox, answer the questions,
Okay.
do the Botox, and we're done.
Okay.
Second option is where I evaluate the whole face, and I tell them everything that I see. And I have, unfortunately, a very keen eye, so I can pick up things that people might not notice. So to be very sensitive towards it, I want to make sure I get their permission before I start pointing out things. And I always give the options. So what are you more comfortable with?
I would love to actually get an objective
Okay, so with your
feedback.
permission, I'm going to get started.
That
Good.
would be wonderful.
Excellent. So if you don't mind, what I'm going to do
Okay.
is two things. One, if you don't mind, I want to see the full face.
Okay.
So just push the hair
That
back
will
a
be
little.
hard, but we can give it a try. Okay, let me see if I can do
Right
that.
this time.
Is that good?
That's good.
Okay.
Perfect. Now I can see the whole face.
Okay.
Okay. I'll let you hold this as well, so this way, as we are talking, you can refer to this mirror as well.
Okay.
The very first thing I start with is always skin. And usually the first question I want to know is the ethnic background. And you appear very Caucasian, so I'm assuming you're 100% Caucasian. Okay, got you. And
Yeah.
Northern European?
Yeah, Northern European.
Okay, perfect. That's great. The reason for that is because, when you are pure Caucasian, your skin can handle a lot of procedures such as chemical peels and lasers better than brown skin like me or very dark skin.
I didn't know that.
Oh,
Okay.
yes. So the Caucasian skin can get wrinkles easier, but they respond very well to those invasive procedures.
Okay.
So that's important to know.
Okay.
Good, so that's good to know. Now, we'll start first with the skin. So the very first thing, and I always say that this is one deal breaker in my practice, and that is use of sunscreen. A lot of my patients are not sure, how important it is. It is the critical thing. From today's meeting, if you were to take away only one thing, that would be sunscreen.
Okay.
And I like to tell my patients that think of it as like a moisturizing cream that you use on your face every day, which happens to have SPF protection in it. That's the better way to think. I do that with my own daughters as well. Because they're little, they fight me on that, so I tell them, it's not sunscreen, I'm putting a moisturizing cream on you. So then it kind of sinks in their head like, oh, okay, daddy, you can put it on. So that's the way to approach it. So the very first thing is sunscreen. That's part of your skincare regimen. So you do that every single day of your life, even on a day like this, which is cloudy outside today.
Okay.
Okay. Are you doing it these?
I actually am. I wish
Perfect.
I had known when I was a little girl to put on the sunscreen, because I think, that would have been a little bit better for me.
Well, you're very lucky. You still haven't done a lot of damage, so that's good. So that's the first thing. Then along with that, skincare products, lotions, potions, I love all those things. They're very critical. I use serums, toners, vitamin C and E creams, use a moisturizer, all of that stuff. In terms of which one to use, that is not as important. There's a lot of great skincare lines out there.
Okay.
I always tell patients, don't focus on the best of it. They're all very good. The harder thing I find is getting someone in the habit of doing it every day. So
Okay.
as long as you're doing it every day, it's fine. That's all I care. If you're not sure what to pick, then I'll make recommendations from the skincare line that we have here. We have PCAs out of Arizona. You can look it up, it's very good, so then I'll make recommendations.
Which actually happens to be a skin line that I have bought in the past and used.
Oh,
I'm very happy
good.
with. So.
Wonderful, so that makes it easy, good. So that's the next step. So that's the first step for skin. Next step after that comes in my practice is microdermabrasion. I'm a big fan of microdermabrasion. Are you familiar with it?
I am.
Oh,
I
good.
have done it several times in the
Excellent.
past.
Excellent.
Not sure how often you normally would recommend to
I would
do
say,
it.
once every 3 months at the minimum.
Okay.
Because it's just exfoliation. And as long as you're not somebody Caucasian with like really red rosacea-like skin, then you're very safe to do it every month, even if you had to do it.
Okay.
So that's very good. Keep doing that. After that, the next step is to even out the color tones of the facial skin. For that, I use IPL. IPL stands for Intense Pulse Light.
Okay.
And that gets rid of the brown spots and the red spots, and it kind of evens out the tone. You're very lucky that you really don't have a lot of that imbalance, so I really don't think you need it at that time. But if you had brown spots, that's what I would recommend.
Okay.
So that's the next step. After that comes then the most aggressive part, which is a deep chemical peel. It's not deep, medium depth chemical peel, or a laser that kind of takes the top layer off,
Okay.
and the new cells come up, which is very good for decreasing the pore size and the fine wrinkles. But again, it's very invasive procedure, so I save it for patients who really have very bad skin with a lot of wrinkles, you know, and a lot of brown spots. You don't have that, so I don't think you need it.
Okay.
Okay, because everything that gets more aggressive has more rewards, but also more risky. So we have to go in a stepwise, logical approach.
Right. Right. Okay.
So in your case, you don't need that.
That makes a lot of sense.
Yeah. So we're done with skin now.
Okay.
Okay. So now we go on to the next thing. I always talk about hair. I know it's funny, but I do, because when I take somebody in my practice, I want to use every single tool to make sure that they look good. They project a beautiful face, and it reflects on my work. So if I have to cheat and use a little bit of, you know, other tricks, why not?
Yeah.
So I noticed already that you are very good with your hair cut and color. That's perfect. Keep doing it. Next thing I talk about is makeup.
Okay.
And the reason is that, you know, women have the advantage that they can use makeup, and they can really make a big difference. And when I talk makeup, I mean your daily routine makeup, 10-minute makeup before you go out to work, or if you're a soccer mom dropping your kids off at school, 10-minute makeup. If you're not good with the makeup, then I tell my patients to see a makeup artist and learn your daily makeup routine, and that can make a big difference. It's the least painful way to look good. It's the least expensive way to look good, so why not use it to your own advantage?
Right.
So are you good with makeup?
Well, I'm one of the
I know
girls.
sorry to interrupt you, but I know you didn't wear it today on purpose.
No, I didn't wear anything today. I mean, I do, again, like I wear makeup to look natural. But yes, I can see a difference when I wear it versus when I don't. But I try just to enhance to be, again, more natural looking.
Good.
I think I'm okay with it.
Perfect.
But I'm sure we can always improve.
Okay, good. Well, that's fine. Because if you're not sure, then I would say, you know, see a makeup artist, get the lesson, and that'll be money well spent.
Okay.
So good. So we're done with that as well. Next, we get to the face. So when I evaluate the face, the very first thing I do is I do a quick glance evaluation. The reason for that is when you go out and you meet people, we don't evaluate faces. But we all know that you walk into a room full of people, right away your mind kind of goes to one person, you say, well, that's a pretty face. And the mind can do it in a split second. So it's very quick because the processor up here is very fast. And we know that it's based on proportions and symmetry and other things. And that helps the brain unconsciously decide what is a pretty face. So when I take a quick glance, everything is in proportion. There's nothing distracting, and that's what we want. Because if there's something distracting, for example, like a very small chin or a crooked nose, then the brain kind of notices that, okay, this face is not as pretty. So we don't want anything lying out there. So when I take a quick glance, it looks great. So you're way ahead of the game.
Oh, good.
So you're way ahead of the game. So now let's take a look in the mirror, and we'll start from the top and work our way down. Okay. So the very first thing on the top is the lines here. I want you to raise your eyebrows. See the lines right there?
Yeah.
Yes. You've had Botox before, so that's very smart. It really works very well in these lines to make them nice and smooth. You know, I tell all my young patients to start Botox early on, because you want to not only fix the lines, you want to prevent the wrinkles in the upper face from becoming deep grooves. Because once they do, then we need fillers as well. Okay. And if you keep doing it regularly, then they can almost diminish to the point that they're not noticeable.
That's amazing.
Next, we come to this area. This is the muscle that goes like this.
Yeah, this is a hard area.
So I want you to frown. There you go. Okay. So right there, it works very well, and it kind of opens it up. Now, when it opens it up, you'll still see this central line.
Which I've had since I think I was really young.
Exactly.
Yeah,
so
I know. It's been a hard one to, I think, control.
It's hard, but you know, the good thing is we can fix it. If you say, well, I want to make it almost go away, then we'll have to use a filler like Restylane or Juvederm in there to make it really nice and soft, along with the Botox. I always do the Botox first, so I can see how much improvement we get with that. And after that, if it's still not good, then do the filler.
Okay.
Okay.
That makes sense. Yeah.
Now I want you to smile at yourself. You're good at smiling, so there you go. The crow's feet.
Yeah, I like to laugh.
There you go.
Yeah.
It works very well for that area.
Okay, so you can actually...
Make a big difference
Okay.
there. Soften up the wrinkles. They don't disappear completely
Right.
with Botox, but they soften up.
That's good.
So those are the 3 most common areas for Botox.
This is very...
Glabella, between the eyebrows,
Okay.
forehead, and crow's feet.
Okay.
Okay. Then we go into the eyes. Now you have very pretty eyes, and I know you've had your upper eyes done, which was, I think, a very smart thing to do because I can really see your full eyes and they really sparkle.
That was a wonderful thing. I'm very happy I did that. It made it still look very natural. People didn't really notice it, but they felt like I just looked less tired. That was a very happy day in my life.
Good for you. That's great. And the reality is that, you know, for most people, when you get older, that's the first surgery that I end up usually doing in most of my patients.
Yeah.
Because the upper eyelids just kind of like get heavy with time, the eyebrows come down, and that's such an easy, quick surgery to do that it really is very, you know, manageable. So the one thing I tell patients is like, you know, if you cannot see your eyeshadow, that's the time to get your eyelids done.
Right, and I couldn't.
That's it. That's exactly what it is. So,
Okay.
Okay, so that's very good. But then we come to now the lower eyelids.
Okay.
In the lower eyelids, if you notice, you have some extra skin
Yep.
and a little bit of fat underneath here. And for that, what we do is lower eyelid blepharoplasty, where we go inside the eyelid, take out
Okay.
the fat, then go underneath the lashes to take out a pinch. And so when you take
Okay.
out a pinch of the skin and that, it looks nice.
So
and
that looks
smooth.
nice, and you don't
Like
get
that.
these baggy kind of things.
Exactly,
Okay.
yes. That's what we can do. So that would be the next step for you down the road, whenever you feel ready to get the lower eyes done.
Right, because now I feel so happy, I think, with my upper that I have noticed
The
a little
lower is
bit on
bothering
my
you.
lower, and I realize
Uh-huh.
that
That's
might
very
look...
common. Absolutely, that happens. So now, some of my patients come and they say that I'm not ready for it. Can you do something to help me while I'm waiting for it?
Okay.
For that, we have a little trick. This groove, if you notice right here, we call it a
Ye-
tear trough or nasojugal groove. And this is very deep, and it kind of like demarcates the boundary between the lower eyelid and the cheek.
Okay.
Gives a shadow effect, making the bags look worse.
Yes, I've noticed that when I try to put makeup
And
on.
yeah, you can't even hide it that well. So for that, we can inject a filler in the groove right here to kind of fill it up. And that brings the lower eyelid and the cheek at the same level to some degree. And it
Okay.
gives the illusion that you don't have bags.
Okay.
So that's kind of like an instantaneous fix, and it's good for about 6 months and sometimes even longer. That might be something good for you to keep it going.
Yeah.
Till you're ready for it.
Yeah,
So that's what
yeah.
we'll do. Okay. Now let's go on further to the cheeks.
Okay.
Now, in the cheeks, I'm looking at the whole face. If you pull out your pictures from when you were like 30 years old or 25 years old, you will notice that this area was fuller.
Yes.
As we get older, we lose bone in the body and in the cheekbones.
Really?
Absolutely. Absolutely. Think of yourself when we are 18 years old as a grape. Round, juicy,
Right.
wrinkle-free. When we are 80 years old, we're like a raisin, all deflated.
That's true.
So we are shrinking. So because you're losing bone, fat, collagen, all those things, everything is kind of shrinking. So as that happens, we wrinkle up more, and we have to kind of try to fight that and make some more collagen and increase some volume in the face.
Okay.
And that's part of the reason, like even now when you laugh and smile,
Yeah.
you get all these lines. You didn't have as deep lines before.
Right.
Because now the skin hasn't shrunken, but everything else has shrunken.
You never would think that the bone would actually do
Oh,
that,
it
but that
does.
makes a lot of sense.
Oh, it does, it does.
I guess the face changes,
It
right?
does, absolutely. So what happens is the cheekbones, which are pretty strong, as they lose bone, they kind of sink into the face.
Okay.
As they're sinking into the face, they can't hold up all the skin and the soft tissues, so those start coming down.
Okay.
It's almost like you're wearing somebody's clothes who's older than you.
Right,
So you know
it's
you
just-
look yeah. So because skin is still there, but other things have shrunken.
Right.
So that skin envelope starts coming down.
Okay.
So we have to build up that area. If
Okay.
we were to build up the cheek area, a little bit of the temples here, it'll bring you back to where you used to be with a fuller look.
Okay.
For that, we use fillers.
Okay.
My favorite filler for that is Sculptra because it makes you produce your own collagen
Oh, okay.
in that area. And that's what I recommend to all my patients because we can literally sculpt your face. And it takes a few sessions, but it gets to a point where you look good and then you can just leave it alone for 2 years to 3 years. 'Cause it's
Oh,
very long
okay.
lasting.
So it's not like you have to do it every, 6 months
No,
or
no,
so.
no,
So
no.
it's a much different way of
Absolutely.
approaching it. That's
Absolutely.
a wonderful thing.
Yes, and so that's what I recommend. And when we rebuild this area, then it takes you back to where you used to have a little bit more full cheek, and this is the effect that you get. Now, if you notice there, Karen, right there, these grooves.
Yeah, I do. See, they disappear.
I'm working over
or
there.
they're soft. They're
Yes.
softer.
Exactly. These grooves, for the longest time, we, the plastic and cosmetic surgeons, told patients, we need to fill these because they're getting deep. But that's not the problem. That's just the end result of this whole area restructuring.
Oh, okay.
That's what happens because things are coming down. So filling this is okay to take away the harshness, but that's not going to fix the underlying problem. It's just a Band-Aid.
Okay.
So the real problem is reshaping all this area
Okay.
to make it better.
Okay.
Okay. Now, we have used cheek implants for that thing as well. I'm not a big fan of cheek implants anymore because we can achieve the same result with fillers, which are non-invasive, and there's no downtime. So why not?
Yeah,
Got it?
Yeah, that makes a lot of sense too.
Good. Now, with Sculptra, that's for the long term because it builds up slowly and gradually. If you came to me and you had an event coming up and you said, listen, time is of the essence, do something quickly, then I would use either Radius, Juvederm, or Restylane because those are instantaneous.
Okay.
And that will fix it right away. And you can use them in combinations. I've had times where I've done both on the same day. One for immediate result, like Radius, and Sculptra for the long-term result.
Okay.
Yeah. Good. Good. Okay. So that's this critical area. Now, after doing that, let's say if you didn't do anything and this kept coming down, then this is you in 10 years.
Okay.
We don't want that.
No.
Okay. So if you keep maintaining it, then that will not happen. Okay. Now, these grooves, as I said, they don't take away the beauty of the face, so you really don't need them injected. But if somebody says, listen, they bother me, they're deeper, can you soften them up? Absolutely. If you can use any filler in the groove, it'll soften it up immediately and you're good to go.
Okay.
Then we come to the lip. And if you notice that I'm just skipping the nose, and the reason for that is when I do my facial consultations, I never talk about the nose.
Okay.
Unless somebody comes for a rhinoplasty question.
Okay.
The reason is that the nose does not add to the beauty of the face significantly. Its only job is not to distract. If somebody's nose is distracting enough, then I might bring it to their attention. But you could have like a little crooked nose that's not noticeable. Or you could have a perfect nose, but you don't like certain aspects of it. You come for the nose job, that's a different story.
Right.
Otherwise, I don't like to put any ideas in someone's head about, oh, you need this nose job done. Because the reality is, you can fix any nose and change the way you want it
Right,
to.
right.
But if it's not broke, why fix it?
But that's also your character a lot.
Exactly.
So it's a good thing.
Exactly.
Yeah.
Exactly. Good. Okay. So now then we go down to the lips.
Okay.
So with the lips, you're very lucky that you have beautiful shape of the lips. Now I want you to pucker like you're trying to whistle. There you go. So these vertical lines.
Those bother me.
I don't blame you at all. I mean, that's... Now, if you remember, we talked about the grape to the raisin theory. Same thing. You're losing collagen. So to fight that or to correct it, what we do is we use the fillers. This is a very sensitive area in terms of the fillers we can get away with. So I only like to use the hyaluronic acid fillers there, like Restylane and Juvederm.
And that would just kind of help smooth this a little bit without making...
the lip big.
Okay,
Exactly.
that's very important.
Exactly. I'm not a big lip guy. I like to be very conservative with the lip. For these wrinkles, what we do is we go under the skin and we put Restylane or Juvederm underneath the skin like a carpet underlay. So all over the white part of the lip to kind of bloat it out and soften the wrinkles.
Oh, okay.
This reduces the wrinkles, but it does not make the lip look big.
Okay, because that will be important for me, again, to look as natural as possible.
Perfect. That's exactly what I would recommend then. Good. Then we go down further. So now we come to a very critical area. This is the lower half of the face. And when you look in this area right here, this is very critical because here you see these little bulges, they're called jowls.
Okay.
We talked about everything coming down. As it comes down, it adds to the jowls. That's one reason. Second reason is we talked about the bone loss. Now the bone loss is also happening not just the cheekbone, but also in the jawbone. Right here, this is the first area where we lose it, and a little bit in the back here.
Okay.
It breaks your jawline. If you look at your pictures when you were like 20 years old and you have a side view or profile, you'll see that it's a smooth jawline without any bumps on the way.
Yes, I have actually, when you meant, yes.
So
I've seen that.
You've seen that?
Yes, I've seen
So
that.
now, unfortunately, what happens is that as we get older, we get here is down, up, and down.
Okay.
So that takes away the beauty of the profile of the jawline. And there are two ways to address that. One way is to use a filler to fill up the depression here, right here. And we can, when I put fillers in here, I put it in this triangle shaped area like here, here, here.
Okay.
I personally call it the marionette chin triangle. Because it's not just one spot, but almost like a triangular area that needs to be filled in.
Okay.
So we fill that, And behind here where we lost bone, in your case is right here.
Right.
Right here is the depression and right here.
I see it.
So when we fill those in this, then it becomes a smooth jawline.
Okay.
And that's what we want. So that's one way of doing
Okay.
it, and it can work very well. The other way is an invasive way where we can pull it back. So now you can see the change. That is like a mini facelift or a facelift. And it really is the fastest way to make a big change.
That does make a big difference.
Right there.
So mini facelift, you lift just part of the face, and total facelift is the whole thing then?
Total face, yeah, you know, it's very tricky actually, and it's very confusing. A lot of people don't even understand the difference. When you say facelift, it involves right from the top all the way down.
Okay.
So that would include basically your brows,
Okay.
your cheeks,
Okay.
the jawline,
Okay.
and the neck, everything.
Okay. Okay.
But not the eyes.
Okay.
They're separate. So all of that area, that's
Okay.
facelift. Mini facelift is when you're limiting it up over here in this area only right for the jowls.
Okay.
So the difference is that the incisions are smaller, they're not as big, and it's only a limited result in that one area.
Right, but it makes...
It makes a big difference
yeah.
right there. So some people need the full thing, some people need mini. For you, a mini facelift will work just fine
Okay.
by pulling it back. Now, when I'm doing this, I want you to look at the neck as well. It kind of
It
see
lifts,
that?
it lifts the neck too,
as well.
here. Because
Exactly.
this I've noticed also a little bit. So when you're
Well, you're being
doing...
too critical, honestly. So your neck is very good. Your neck is very good. It's really nice. You can see it, look in front. This is very normal for aging. So
Okay.
but you're looking at those bands. As we get older, the muscle that runs here and meets in the center starts separating. And as the edges separate, they become fine bands here. Once you start getting a double chin
Okay.
or loose skin hanging, it's very hard because
Okay.
that's one area we don't really have any good non-surgical option. There's some lasers out there to tighten the neck skin, maybe even melt the fat, but nothing is really that great. So
Okay.
I've not seen anything good, or I haven't heard anything good
good.
happen. Yeah, I mean,
Yeah.
it works, but not to the point where you can say, oh, I'm so happy I did that in the neck and
Right.
all that is gone.
Okay.
So right now you're fine. At some point when you get down the road to where you feel like, oh, the neck is an issue, that will be addressed. Now, if you decide to do a mini facelift at some point, I always do the neck as part of it.
Okay.
So what I would do is, along with pulling it this, I always go under the chin and tighten this muscle as well.
Oh, okay.
So this way, by pulling and tightening here, it becomes a smooth neck.
And it still will look, I mean, it still
look
will look
natural.
very nice and
Absolutely.
natural. Yeah.
Absolutely. No reason to overdo it.
Yeah.
Okay. Then I come down further. I always tell my patients, when you're doing your skincare, don't forget that the face, the neck, and the upper chest are all one unit. Every now and then you'll run into someone who has a beautiful face in terms of skin, but then you happen to notice that the chest is like all dark with sunburns and stuff and not looking great, and that doesn't look very good. So you have to include this area in all your skincare regimen.
I actually do put sunscreen.
You do? Very
yes,
good.
I do.
Good. And even when you go for microdermabrasion, you can ask the person, like, I would like to have it on my chest area. It's perfectly fine to do it.
Yeah.
Good. That's excellent. So that's pretty much like wraps up everything.
Everything. Okay. So like for me then, like what should I do? What should I start to, kind of get a few things just a little bit?
That's what everybody feels at the end.
Yeah, right.
Either they're shocked, either they're shocked and they're like, oh my God, I need a lot. I'm like, no, you don't need a lot. You don't need any of this. It's something that you need to be aware of.
Right.
It's not something you have to do. And then you say, okay,
But
what is good for me, what is not?
Right, but what would be like? Where should I go? Where
Yes.
should I start?
Everybody says the same question. I always tell them this answer. Start with what bugs you the most, because
Okay.
that's likely to make you the happiest. So
Okay.
only you know what bugs you the most.
Right. So the eyelids did bug me, so I did have
Good.
that and
So
this.
got that out of the way.
Yeah, so that's a good thing. I have noticed this
Aha.
very, very much on me. So that's probably something when I'm doing the makeup in the morning, I was like, oh
That's
no,
bugging
what
you.
am I doing?
There you go. That's easy.
And I never smoked or did anything, but it's still there.
That's easy.
And then I have noticed, I
That
guess, the
area?
dark area there.
Wonderful. Both are easy because those are both Restylane or Juvederm, and it'll work very well. That's what most people do. They start with the least invasive, like fillers and
Right.
Botox, and then they progress their way to other things. That's what they do.
Right.
Good. So that's great.
That sounds actually like a good plan.
Wonderful. Any other questions you can think of?
Like the fillers, for example, you talked about sculpture.
Mm-hmm.
Is there any? Could I go back to work right away, or
Oh, yeah,
is it
yes,
any?
absolutely.
So it's very.
I'm glad you were asking. I'll give you my instruction sheet.
Okay.
I have because it's so common that I made this instruction sheet.
Okay.
And this kind of guides you how to prepare when you come for the fillers and Botox.
Okay.
And this will tell you what to avoid, like vitamin E, fish oil, aspirin, Motrin.
Okay.
And, this way you're less likely to bruise.
Okay.
Okay, that's important. Also, if somebody says, I'm not good with needles, we can call in an Amla numbing cream for you, so you can put it on before you come.
Okay.
Wash
Is
your
that
face really well.
like a number? Or?
Yes,
Okay.
exactly. So
Okay.
you use that. And also in the bottom, I list all these, the Botox and all the fillers with their prices, so this is going to be handy for you whenever you
Okay.
want to come, and then you
Okay.
can prepare accordingly.
So, I mean, it's really no downtown or anything. You can
No.
basically have a procedure and then
go.
you can go back to work and
Absolutely.
do what you need to do. That's actually very good.
Absolutely. Well, thank you, Corinne, for doing this
you're
consultation,
welcome.
because it's going to help a lot of other people, because then when they watch this, they'll already know, what to do.
What to do,
And every time you come to see me, I do with all my patients, whatever you come for, I'll do it, and then I'll tell you what is next.
Right.
So this way you don't have to guess, like, well, what should I be doing next?
Okay.
I'll guide you. My goal is to manage your face for as long as I'm in practice.
Right, and I think you have a very good sense of how to make it look, beautiful but natural without the least invasive.
I'm starting with a very pretty face, so I can't mess up. So thank you again. It was a pleasure.
Thank you. It was so nice to meet you. I've heard so
Same here.
much about you. Thank you.
Thank you very much.
Thank you.